Hey there, I know how much you care about your child's health. As parents, our children's well-being is always at the forefront of our minds, and any potential health issue can be a source of worry. And today, I want to talk about something every parent should know. A condition that, while treatable, requires prompt attention and awareness. Appendicitis in children. It sounds scary, but don't worry because knowledge is power. I'm here to break it down simply and help you feel more prepared to recognize the signs and know when to seek medical help. So, what is appendicitis? Let's start with the basics. The appendix is a tiny pouch attached to the large intestine, a small finger-like projection. And sometimes, for various reasons, it gets blocked and inflamed, leading to a painful condition. That's what we call appendicitis. It's an inflammation of this small organ and it requires medical intervention. It's more common than you might think, affecting a significant number of children and adolescents each year. And it can happen suddenly, often without any prior warning signs, especially in kids and teens between the ages of 10 and 18, although it can occur in younger children as well. Now let's talk about the signs you shouldn't ignore. Recognizing these symptoms early is crucial. The most classic symptom is belly pain that starts near the belly button, often described as a dull ache initially, then shifts down to the lower right side, becoming sharper and more intense in that specific area. This shift in pain location is a key indicator. Some kids also lose their appetite, suddenly showing a lack of interest in food, feel nauseous, experiencing a queasy sensation, throw up or develop a fever which can range from low grade to quite high. These accompanying symptoms can help paint a clearer picture. If you notice your child holding their side, particularly the lower right side, not wanting to eat, seeming extra tired and lethargic more so than usual, or having these other symptoms, pay close attention and consider the possibility of appendicitis. Trust your gut. As a parent, you know your child better than anyone else. If your child's pain doesn't go away, despite home remedies or over-the-counter pain relievers, or if it gets worse, becoming increasingly severe, it's time to act. Don't hesitate to seek professional medical advice. Don't wait it out, hoping it will resolve on its own. Call your doctor or head to the emergency room for an evaluation. Early diagnosis is key. Getting treatment quickly is the safest choice, minimizing the risk of complications. Because waiting can lead to serious complications like a burst appendix, which can cause a widespread infection. Once you see a doctor, they'll do a careful exam, checking for tenderness and other physical signs. Maybe some blood tests or an ultrasound, or possibly a CT scan to get a clear picture of what's happening inside, to figure out if it really is appendicitis and rule out other possible causes of abdominal pain. If it is, the usual treatment is surgery to remove the appendix, a procedure called an appendectomy. Most kids bounce back fast after the surgery, experiencing a relatively quick recovery, and are back to their normal selves in just a few days, resuming their usual activities. I want you to feel reassured that appendicitis is a very treatable condition, especially when caught early. With early care, children almost always make a full recovery from appendicitis and go on to live healthy, active lives. The key is acting fast, recognizing the symptoms, and seeking prompt medical attention. And listening to your instincts as a parent, trusting your gut feeling when something doesn't seem right. So, if your child has belly pain that won't quit, that persists or worsens over time, don't ignore it. Trust yourself and get them checked out by a healthcare professional. It's always better to err on the side of caution. You know your child best. You are the expert on their health and well-being, and your quick action can make all the difference in ensuring their speedy recovery and good health. Stay safe with Dr. Mohammed Mari.